Hey everyone, my name is Andrea and I'm going to be talking about some mental health resources in my area that assist people who are struggling with mental health issues such as anxiety, depression, schizophrenia, and other cognitive mental health disorders as well. Mental health resources are incredibly crucial in today's society, and knowing where they are and what different types of services they offer and how to access them is important for individuals struggling with mental health, and it is a crucial start in the mental health recovery process. It's important to seek out the resources that are available to you if you're coping with constant feelings of sadness, anxiety, anger, feelings of being overwhelmed, you have low energy, loss of motivation, uncontrollable intrusive thoughts, panic attack, thoughts of suicide, relationship difficulties, addiction issues, or constant memories from a previous trauma. It's important for each person to understand and be aware of the resources that are available around them to help. As we've talked about, mental illness affects multitudes of individuals just in Ontario alone, and mental health is something that a lot of people struggle with, and it has continued to worsen throughout the COVID-19 pandemic. There are multitudes of resources and clinics that are available to help treat mental illness. They're primarily located in higher populated cities. Many mental health disorders, depression, anxiety, cognitive mental health disorders, can affect an individual's life dramatically and cause a very negative outcome for an individual who doesn't receive proper treatment or have the proper resources to deal with it. The outcomes of mental health struggles can result in loneliness, despair, and addictions to substances in place as their best attempt to cope with their mental health, loneliness, previous trauma, when they don't see any other options that are available for them. Some of the resources that I focused on throughout this assignment are addictions clinics that specialize in dealing with mental health that is attached to addiction. Addiction is a response to pain, internal suffering, and trauma. I believe that addiction is an attempt for an individual to escape their suffering, but it is a very harmful escape and only a temporary fix for underlying mental illness. A resource that I found very interesting was the ACT Clinic. The ACT Clinic is an organization that is not for profit, and it's based out of Toronto, Ontario. However, they do have a clinic available for help in Brantford as well. They focus on and offer cognitive therapy for their patients, which is a type of psychotherapy that challenges an individual's negative thought patterns about themselves, the world around them, and their future. It's also used to treat mood disorders, depression, and negative behavioral patterns. ACT also offers opioid substitution therapy, which helps individuals who struggle with opioid addictions, and they offer medical treatments and medications that assist the addicted individual in counteracting symptoms and side effects of the opioid withdrawal. Turning Point is another agency that is based out of Brantford, Ontario. They offer confidential and individualized therapy for mental health disorders, depression, and anxiety. They also offer therapy for alcohol addiction and substance abuse, as well as trauma, post-traumatic stress disorder, childhood abuse, sexual assault, and stress that affects mental illness. Another resource that I found in the Brant area was the Canadian Mental Health Association. This organization is incredibly well known, and they offer services from a base in Haldimand, Norfolk, and Brant County area as well. The Canadian Mental Health Association offers counseling services, court support services, housing, crisis stabilization beds, relaxation, and creative expression, and a creative expression art group, which is a program where clients are able to express themselves through art, painting, clay work, and other forms of expressional art as well. St. Leonard's Community Service is another well-known mental health resource, and they have many different locations where they offer services as well. St. Leonard's provides counseling for a client struggling with addiction and mental health. They also offer family counseling and counseling for any loved ones related to the individual struggling. St. Leonard's offers programs, many programs to be a part of. The individual is able to take part in biopsychosocial assessment that helps determine the individual's strong suits as well as their needs. Cognitive behavioral therapy, support groups, and counseling using motivational interviewing as well. The START Clinic is another resource that I found. They're actually based out of Toronto, Ontario, so they're a little bit further, but they offer a huge variety of different programs such as cognitive behavioral therapy again, psychotherapy, diagnostic assessment, medical treatments if it's needed, and mindfulness-based treatment, which is an approach to use cognitive behavioral methods as well as meditation practices in order to come together as a method of therapy. Their main goal is to assist the clients and the individuals that go there in finding mental well-being, and these are a few ways in which they do that. They provide a lot of information about working with anxiety and the different anxiety disorders that they assess and treat in their clinic. Some, but not all of these disorders include panic disorder, which is when an individual experiences constant panic attacks without any specific triggers for it. Agoraphobia, when a person can't move out of what they have deemed to be their safe space without having severe anxiety. Post-traumatic stress disorder, which is when a person has gone through a traumatic event and they have a difficult time connecting with reality because they're in a constant state of reliving that event in dreams or flashbacks. Social anxiety, the fear of being around unfamiliar people and in unfamiliar places, and the judgment of themselves, as well as generalized anxiety disorder, which is an intense and frequent worry about everyday circumstances and situations. Although START Clinic works with multitudes of anxiety disorders, they also experience and help patients who come in with ADHD, which is attention deficit disorder, and other cognitive disorders that they might struggle with, and they strive for mental well-being by psychological assessment and other tools as well. There are many volunteer opportunities at the START Clinic, and they're constantly seeking people for telephone screenings, data entry, training on clinical assessments, as well as other duties. They're requesting that psychology and resource experience would be in favor, but they will definitely consider it without. Social workers and help in these resources they play an incredibly huge part of benefiting, and overall just understanding the resources that are available. If you are struggling with mental health and you are able to reach out, a lot of them are nonprofit and free to you.